This is Sarah Mikesell, and today we're here with Dr. John Middleton. He is a professor at the University of Missouri. Today we're here at the international meeting for the National Mastitis Conference in Milano, Italy. So thanks for being with us today, John.
Thank you.
Can you tell us a little bit about kind of some of the early signs that dairy producers see with contagious mastitis?
So with contagious mastitis, a lot of times it's subclinical, so very difficult to detect with the naked eye. And so usually we have to use some indirect measure to say that the cow actually has mastitis. So that might be something like very initially doing something like the California mastitis test or detecting an elevation in somatic cell count. But the thing about using the California mastitis test or an elevation in somatic cell count is it doesn't tell us what bacteria is present. So we could have subclinical mastitis with a bacteria that leaves the mammary gland quite quickly and therefore doesn't present a long-term problem for the cow or for the herd. Whereas if we're dealing with something like Staph aureus or Strep agalactia, possibly mycoplasma, some of those organisms that can be subclinical get into the mammary gland, they can stay there for a very long time, and they present a reservoir for other cows in the herd, and generally transmission occurs at the time of milking. And so there are occasions where we need to be able to name the bacteria so that we know which one it is and whether it's going to pass from cow to cow, and therefore we can name the bacteria, identify the cow, and do something to manage that cow so that she doesn't spread bacteria to other animals. So conventionally that's been done with routine culture, and in the case of a slowly spreading subclinical infection, culture may be a reasonable way to do that, but there are systems where we need culture independent methods maybe to more rapidly detect the bacteria, or for example in an automated milking system where we are not taking samples individually from the cow, there might be opportunities to do culture independent types of techniques in the future where we can detect contagious pathogens at the time of milking. So culture independent techniques can also be used, such as PCR, to diagnose the bacteria that are in the mammary gland. And we can use culture independent techniques at the mammary quarter level, we can use those at the cow level, or we could use those at the bulk tank level. And at the bulk tank level we're doing a very crude screening of the population of cows to say, are there contagious pathogens in this population of cows? And so by screening the bulk tank we can keep measure of, are there Staph aureus cows in this herd, are there Strep ag cows in this herd, are there Mycoplasma bovis cows in this herd? And then once we figure out whether we're finding contagious pathogens, we can mine down to the cow level or even the mammary quarter level to look at which cows are contributing those contagious pathogens to the bulk tank. So one of the advantages then to a culture independent technique is if we're only screening for contagious pathogens, let's say at the bulk tank level, is that we can do that routinely on samples that are collected as part of our monitoring system. And if we happen to find those organisms, then we know we need to look more closely at the rest of the cows in the herd to make a diagnosis. So different ways to do things. Initially we might detect the inflammation, so that would be the California mastitis test or the somatic cell count. We would then want to know, do we have contagious pathogens that are causing that elevation in bulk tank somatic cell count? And then if we do have contagious pathogens in the herd at the bulk tank level, how do we mine down and figure out which cows have those contagious pathogens so that we can control the spread of disease? And we can do that either with conventional culture, or these days we can do that with PCR-based techniques. And the reason that culture-independent PCR-based techniques probably work well for us for the contagious pathogens is that the contagious pathogens typically are harbored by that cow. And so if it's in the milk of that cow, it probably means that that cow is in fact a reservoir. Whereas some of the other bugs can be found on the outside of the cow's teat skin, they can be found in the teat canal, and if we find those in milk samples, so let's say some of the classical environmental pathogens, we don't necessarily know whether they came from within the cow's mammary gland in that milk sample or whether they came from sources that contaminated the milk sample as we took the milk sample. So when we're looking at the other pathogens, aseptic sampling is very important, whereas for the contagious pathogens we can screen at much higher levels like the bulk tank to say, okay, these probably are coming from cow's milk, therefore if they're in the bulk tank they're coming from cows that are infected with these pathogens. So culture independent techniques on bulk tank type samples for contagious pathogens are a reasonable thing to do. When we start looking at bugs that can be found in the environment as well as in cows, that's a little bit trickier to determine if it's in the bulk tank. Did it get there because we've got dirty teats, because we've got street canal colonization, have we got dirty equipment? Whereas for the contagious pathogens, because we think generally they come from inside the mammary gland, screening at the bulk tank level for those bugs is quite relevant to what we're trying to do to control mastitis.
Very good. Well, thank you so
Okay.
much for all the information.
You're welcome. Thank you.
This is Sarah Mikesell reporting.